Greetings, I'm Rukhsana Ahmed, Associate Professor and Chair of Communication at the University at Albany State University of New York. And it is my pleasure to introduce my co-editor, Dr. Devjani Sen, Professor at Algonquin College in Ottawa, Canada. We edited the publication titled Privacy Concerns Surrounding Personal Information Sharing on Health and Fitness Mobile Applications.
A number of things motivated this book, but I think the main one is that as an avid social media user, like most people these days, one day I was using Facebook and I was realizing that even though I am a professor of media studies, I was using it and I was sharing so many personal informations about myself, and I was doing this even though I know it's not a good idea, and I was sharing pictures and so forth. And I was motivated by a need to better my persona, better my public image, and get some likes, to be really honest. And I thought, if I'm doing this, how many people are doing this without realizing the danger they're putting themselves in? So with the advent of, with the plethora, I should say, of so many health applications and fitness and wellness applications these days, a lot of people are entering health information, which is very, very personal, and yet these apps require it. But where is this information ultimately going? To which unknown third parties? So this is a very important issue in today's society.
So it was actually 2 international workshops that my co-editor and I organized back in 2016 at the University of Ottawa in Ottawa, Canada. And we sort of extending the dialogue that began in those 2 workshops. And they were titled Towards Better Privacy Policies, Developing More Ethical Guidelines for Sharing Personal Information on Leisure and Fitness Applications, and Fostering Dialogue to Explore the Ethics of Sharing Personal Information on Leisure and Fitness Applications Towards Better Informed Consent. So our aim with the book is to generate discussion around broader questions such as how aware are creators and users of mobile health and fitness applications regarding what ultimately happens to information gathered through these apps. How much users' consent is needed for exchange of sensitive data? Who other than the app creators use consumers' data and how? So as you can see, these are very complex questions which require multidisciplinary approach and diverse perspectives. And that is what we were able to do through the book, because we were able to bring together and also provide a platform for a multidisciplinary group of scholars and practitioners who have expertise in a diverse range of areas such as business studies, communication studies, computer science, engineering, government and public safety, healthcare, information technology management, legal and media studies, management information systems, philosophy, psychology, and public health, and who were able to address the complex and rich issues under considerations. So in a nutshell, interprofessional collaboration provides opportunities to problem solve, learn together, and create communities of practice, which my co-editor and I aim to do so through this book.
In my opinion, not just lawyers and legal scholars, but psychologists, communication scholars, anyone who wants to better understand the human mind and what motivates us to even put ourselves in danger in order to, look good on social media, and also when we're using apps. What motivates us to do certain things that sometimes seem counterintuitive to our own safety? With the release of Apple smartwatches, Series 5, and then Fitbit smartwatches with GPS, we can give consent to the release of personal information to third parties. But when they're recording, when such devices are recording us when we're sleeping, health information, are we really able to give consent at that time? These are very gray and ambiguous areas of research and concern. So we want to explore these kinds of issues further in our book, and I think that's why it's a timely publication.
We envision our book as an invitation to raise awareness and create dialogue around the pervasive and widespread use of mHealth apps, especially their judicial, responsible, and ethical use, which could result in safeguarding end users' data privacy. And as we are living in the middle of a pandemic, with the acceleration of the COVID-19, we also see dramatic increase in the use of and reliance on mobile health and fitness apps for health information seeking purposes. So in our pandemic world, super surveillance is now the new norm. So moving forward, my co-editor and I believe that it is important to consider what directions future interprofessionals dialogue around users' right to privacy information disclosure and healthcare will take, especially considering the uncertainties that surround data privacy changes during the COVID-19 outbreak.
Suitable for use in your course syllabus and as an integral resource for research advancements within your department, this publication should be included within your institution's library along with these related publications.
Offered in print, ebook, and print plus ebook, and as a part of IGI Global's ebook collection, this publication is available through IGI Global's online bookstore, as well as many other major booksellers and platforms, including EBSCOhost, Gobi, ProQuest, and Oasis. Purchase or recommend this title to your library today.